in ethics. He'll be talking about ethics in anesthesia, and he has a lot of achievements, including Distinguished Services in Specialty of Anesthesia Award, Young Teachers Award. He's Joint Secretary ICACON 2022 held in India, and he's editorial member and reviews various journals. Welcome, Dr. Kapil Chaudhary. Let's hear about the ethics in the anesthesia.
Thank you, sir.
Good afternoon, everyone. Today I'll be discussing the topic of ethics in anesthesia. So why is this topic important for the postgraduate level and why is it kept in the PG assembly? This is because ethics is very important for future practice because it helps engenders patient trust with you and helps the patient develop autonomy. Also, it avoids medical legal issues, and often there's a written question or a soft question in exam in the form of an OSCE. Now, what is ethics? Ethics is concerned with what is good for individuals and society. And a medical profession is highly regulated by ethical standards and legal rules and regulations in order to achieve ethical practice. The ethical guidelines in medicines have been issued even for the registered medical graduate in the Indian Medical Council Professional Ethics and Ethics Regulation 2002. And also the Indian Society of Anesthesiologists has recently published the guidelines for practicing anesthesiologists in India, in which there is a separate section on guidelines for ethical practice. The basic principles of medical ethics are basically non-maleficence, autonomy, justice, and beneficence. Non-maleficence means there is do no harm to the patients. Autonomy means that the patient is independent, who can make a full informed decision regarding his or her health care. Justice means that the anesthesiologist should be fair while providing their services to the surgical patients. And beneficence means that we have to do good for the patient in every situation. Now, the anesthesiologist is often faced with ethical dilemmas. That is that the patient is mostly unaware of the anesthesiologist's presence. Anesthesiologist is always behind the screen. And anesthesia invariably involves using machines and gadgets in the patient cares. And these factors basically leads to potential dehumanization of patient care, which leads to ethical dilemma. So based on this, and because of this, the ethical issues can be categorized as either preoperative, intraoperative, or postoperative. The preoperative issues faced are the lack of familiarity, which can be easily resolved by effective communication, which helps in establishing a good rapport and comfort level with the patient. And also there are issues like knowing how much to explain to the patient so that the patient does not give refusal to the surgery because of the fear of the procedure or the anesthesia. Many times the fitness for surgery is given by the general physicians whose views may be in conflict with that of the anesthesiologist. And all these ethical dilemmas can be solved by skillful interaction with the patient, surgeon, and other colleagues without having a direct conflict. Regarding intraoperative issues, the anesthesiologist should always guard the patient's modesty and be compassionate to their feelings. At the same time, they should be assertive and avoid domination by other professionals, especially the surgeon, who mainly projects himself as the captain of the ship. During the postoperative period, the anesthesiologist is now the perioperative physician and has a greater responsibility till the patient is discharged. And relying on the surgeon for postoperative pain relief can have ethical implication because an inadequate pain relief is a common shortcoming, and the patient may be in distress and may sue you also for that. So that is where the role of teaching ethics in anesthesia comes. The traditional approach of learning ethical principles is through the examples set by your senior colleagues or the teachers. And incorporating issues pertaining to ethics in every clinical problem is very effective in raising awareness among the students. This can be taught by using the case scenarios and the communication skill models about how to sign a consent, informing critical conditions to the relative. And these are basically assessed in your exam, especially in the DNB1 exams using the OSCE stations. Now, as per the Indian Society of Anesthesiologists, they have given some clinical ethics recommendation. The ISA recommends that before taking up the patient for surgery, each and every patient should undergo a pre-anesthetic checkup in which the history, examination, and relevant investigation should be assessed. If there is any issue, or if you feel the patient is not fit or requires some optimization, then an adequate and appropriate referrals and investigation may also be sought. And then an informed consent for anesthesia procedure, which is separate from a surgical consent, needs to be done. And you should always have a pre-anesthetic checklist before inducing the patient, and you should document all those in the intraoperative record. Intraoperatively, ISA recommends that the anesthesiologist should be present throughout the surgical procedure and be vigilant, and he should record vitals in the intraoperative chart every 5 minutes. Complications or adverse effect, if any, should also be documented. Post-operatively, the anesthesiologist has the responsibility of ensuring a safe transport of the patient from operation room to the post-anesthesia care unit and communicates with the patient and his attendant at the end of the surgery. So the ISA says that the key to success in all the medical legal cases is communicate, document, communicate what you have documented as communication of documentation and documentation of the communication. Now coming to the most important topic in regards to the ethics is the informed consent. So the main predominant ethical principle in anesthesia is respect for patient autonomy, and the expression of patient autonomy is the informed consent of the patients for the medical therapy. So informed consent is a legal term that implies an autonomous, informed authorization by the patient to undergo a medical or a surgical treatment. As per Benjamin Cardozo, a medical practitioner cannot examine, treat, or operate upon a person without the patient consent, as every human being of adult and sound mind has a right to determine what happens to his own body, and any trespass is considered as an assault. So by saying the respect for autonomy, we mean that the patient have the right to determine what happens to them to the degree to which they are capable, and they need to get all the relevant information to enable them make independent decisions based on available facts. And there is no one else who can consent on behalf of competent adults. To promote autonomy, by removing barriers, the anesthesiologist should provide them with complete and accurate information. And if there are any reversible medical condition that may impair the patient's ability to understand, so they should also be treated upon. If the patient refuses a treatment despite the fact that it may significantly improve the health status of the patient, we should respect the decision of a competent adult. Now, there are some considerations that in cases of minor, the consent of the person with the parental responsibility is to be taken. Right. In cases of medical emergencies, life-saving treatment can be given even in the absence of a consent. Refusing treatment in life-threatening situation due to non-availability of consent may hold the doctor of guilty unless documented refusal to treatment is by the patient. So that is why. So in cases, even if there's a life-threatening emergency and the patient of a sound mind refuses for treatment, it should be given respect and document. Now, as per the Indian Penal Code, there are 5 essential components of informed consent. One is disclosure, comprehension, lack of coercion, competence, and informed refusal. By disclosure, we means that we should provide honest disclosure of the medical information, which is vital to provide as much information as possible to the patient to facilitate decision making. The Indian courts generally rely to disclose any information that a reasonable person would want to know to decide whether to go for or whether or not to forgo the proposed therapy. The legal and ethical standard require that the physician accurately discuss therapy and its potential alternative, including no therapy, disclose the common risks because they're more likely to happen, and the serious ones because the consequences are severe. The limitations are that the level of information to provide it cannot be quantified, and it is common to withhold certain vital information if the information may make the patient reject the prescribed procedure. Also, if the practitioner is not under any obligation to provide information not within his scope, like if you're an anesthesiologist and the patient asks you about, the outcome of the surgery and the other, whether the patient or cancer patient get cure it. You need not be going into this details. By comprehension means that the person should be able to understand in his own language, and if there is difficulty in understanding, then an interpreter may also be used. If the patient has any communication problem, special attention must be taken to make sure that he or she understands the thing properly. By regards to competence, it means the autonomy. It's basically the capacity to understand, or the mental functions to understand, to hold, learn, and process the knowledge which is being imparted to the patient. That is what all we are describing, whether the patient is able to understand and assimilate and make a decision based on that. The four elements are basically understanding and appreciating what you're trying to explain to the patient, reasoning, and then evidence of a choice the patient is able to make. An Indian patient is, in India, the legal age for valid consent is 18 years, and a child more than 12 years can give a consent for physical and medical examination. In general, a patient is said to be competent to contract if or he or she has attained the age of majority, that is 18 years, of sound mind, and is not disqualified from contracting by any law to which he is subjected to. So, in general, all adults are competent unless they have been officially adjudged as incompetent, and capacity is often underestimated or denied or curtailed for older patients suffering from mental impairment, patients with intellectual disability, and children, and patients who are maybe on pre-medication. In case of an urgent surgery in an impaired patient, we have to rely on the surrogate decision marker or proceed with the best determination of the patient interest in the mind. And mere presence of an emergency does not invalidate a competent patient's rights to refuse treatment. As every person has a right to make a decision, and the patient may be making a bad decision also. Thus, we have to make ensure that the patient is competent and has appropriate information. Coercion means applying of any undue pressure or influences which should not be there, and the consent should be in a situation where there are no strings attached. If the person refuses to consent to a procedure or treatment that may have a significant benefit on the patient health, the practitioner has the obligation to continuously inform the patient about the procedure or the treatment, and it's then the decision of the patient whether to forego or go ahead with the procedure. Now, use of restraint is basically unethical as to the promotion of autonomy, and anesthesiologists have both the ethical and legal obligation to determine whether such extreme intervention is warranted or not. Refusal of medical care and angry behavior is no proof of incompetence, intoxication, or inability to make medical decision. So when faced with an uncooperative adult patient, we should ask the following question. Is the patient clearly incompetent or merely angry or uncooperative? Does the patient show evidence of neurological impairment, intoxication, or disability? Is the patient in imminent danger? Does the patient pose stress to himself or to the staff on duty? And is there a compelling need to treat the life-threatening injuries? In the absence of any of the foregoing, the use of coercion or physical or chemical restraints is neither ethical nor legal. So what is an actual consent? For an actual and legally acceptable consent, everything must be writing. That is why we say it's a written informed consent, and there should be a signature of the patient in the presence of two independent witnesses, so that to avoid any disputes over the legal admissibility of the consent later on. The patient and witness should write their names below the signature, and the relationship between them should be specified. In case of illiterate patient, the thumb impression and the name should be mentioned below the impression, along with the date and the time. The consent should always be for a specific procedure, and if any other procedure is required, we require to take a fresh consent. For a planned blood transfusion, an informed consent is a must, but if you require a blood transfusion during surgery to save the patient life, then the transfusion can also be done without a consent because it's a life-saving thing. It's very important that a separate consent for anesthesia must be taken, as a surgical consent does not include anesthesia, and it should be documented. We should explain all the pros and cons, and a choice may be given to choose between all the anesthetic options. The consent from spouse is also required in certain conditions like sterilization procedures where the surgery may affect or limit the sexual function, or may result in death of an unborn child. The substitute or proxy consent is obtained on behalf of a patient who is not competent to give consent for medical treatment or refusal for the same. It's acceptable in cases of minors, in cases of unconscious patient under sedation, patients who are mentally unsound or intoxicated, or in cases of any emergency or accidental case where the relatives are not available. For proxy consent to be valid, we have to ensure that the person herself or himself is not in the position to give a consent, and the medical and surgical intervention is absolutely necessary to save the life. Blanket consent, something like it's a common practice previously. At the time of admission, a patient is asked to sign a printed form in which the consent is taken for any type of procedure without specifying the surgery or any treatment. And such blanket consents are not legally valid and hence should be avoided. So whenever you're taking a consent, even if it's a printed form, you have to clearly mention the procedure, the surgery which you are trying to take, and the consent is basically for that surgical procedure itself and then not for anything else which could be done. A withdrawal of consent, that means the patient has a right to withdraw his consent as and when required. And whenever a refusal of consent is there, it is important that it's recorded with date and time. And also, there should be a witness signature when you're documenting the informed refusal, and the two doctors should ideally document the reason for non-performance of a life-saving emergency as expressed refusal by the patient or the authorized representative, and hospital administration should also be informed about the same. If the patient demands discharge from hospital against medical advice, this should also be recorded and the signature should be obtained. So examples of informed refusals in anesthesiology is basically request to withdraw or withhold life-supporting care in the ICU, DNA orders, refusal of blood transfusions, refusal of preoperative testing such as human HIV or pregnancy testing because these have social implication. The ethics regarding the organ donation and brain death will be dealt in a lecture later, I think next day or day after tomorrow. And when patients refuse medical care and insist on what the physician believes to be suboptimal, disclosure of risk and benefit is very important. Now, it is very important that if the refusal to treatment may harm other parties, the court may rule that the patient may undertake a treatment like a patient is having an infectious disease like a tuberculosis or COVID. By refusing to consent, the patient is infecting a lot of people, and so that consent or refusal to treatment by the patient is not held valid. And the court may overrule the decision of a competent pregnant woman also if the refusal has adverse effects on fetal health. Now, based on religious belief, religion has basically a crucial role in the perception and decisions. And the example is basically Jehovah's Witness, whose religion forbid blood transfusion or organ transplant. And in most instances, the court says that the medical practitioner should uphold the decisions of the competent patients irrespective of and give respect for their religious beliefs. Now, coming to research ethics, principles of research ethics or ethical conduct of human subjects are based on 5 principles: respect for autonomy, beneficence, justice, disclosure, and freedom to refuse. So basically, they're all almost similar, and like we have discussed before also. Now, when considering children as research subjects, the US federal law requires assent of any minor more than 7 years to participate in medical research. And if the minor child is able to assent, then assent must usually be obtained in addition to the consent of any legal surrogate decision maker. And children's dissent should always be honored, in which there is no substantive individual benefit is expected from the therapy or a research. Now, the consent in relation to publication, a registered medical practitioner is not permitted to publish a photograph or case report of his or her patient without their consent in any medical or journal in manner by which identity could be revealed. However, the identity is not disclosed and the consent might not be needed, but it's always better to have a consent regarding publication of the photographs or the reports of the patient for any forum or for journal. Now, the consent in relation to the medical research in India should be as per the ICMR or the Indian Council of Medical Research guidelines. Otherwise, it's treated as misconduct. As per the ICMR, the informed consent process requires 3 components: providing complete relevant information to the potential participants in simple language, ensuring that the information is comprehended by them, and ensuring that there is voluntariness or autonomy by them. So all research involving human participants is the prime responsibility of researcher to obtain the written informed consent of the prospective participant or the legally accepted or the authorized representative. And if the individual is not capable of giving consent, or if illiterate, a literate impartial witness should also be present during that process. So it is mandatory that the consent is taken before starting any study, and it's also important for a researcher to maintain the privacy and the confidentiality of the participants at all stages. To summarize, the basic ethical principles in anesthesia includes non-maleficence, autonomy, justice, and beneficence. And ethical principles involves adequate preoperative, intraoperative, and postoperative assessment and judicious management. The basic ethical principles of informed consent include respect for autonomy, ensuring capacity of the patient, complete disclosure, avoiding coercion, along with consideration of religious belief and choice for informed refusal. So good luck for your exams and do your best. Thank you.
Thank you, Dr. Kapil, for ethically covering the ethics in anesthesia and finishing in ethically allotted time. So it's been a great talk. You covered this very comprehensively. And I'm sure there may be some few questions, but I think, are we supposed to have questions now or at the end of the 3 talks? If it's okay with you, Dr. Chaudhary, we can have questions at the end of the 3 talks?
Yes, no issues.
Okay. So next on the line is a very interesting topic and very upcoming and very